Mr. James. Mr. James has come to the orthopedic OPD for some pain in the here. You'll be able to see there. Mr. James has come to the orthopedic OPD with pain in the right shoulder joint for the past 5 days. Examined with a relevant examination and arrived at a diagnosis. So, examiner, this is my GMC number. I understood my task. Shall I proceed with my task? Thank you. I'm here to examine your shoulder. I heard that you are injured your shoulder, is that right? For the purpose of examination, you need to undress above the waist. I'll ensure adequate privacy and ask my examiner kindly be the chaperone. Is that okay? Could you please stand up and with outstretched hands like this? Thank you. On inspection, both the shoulders, both the elbow, both the wrist joint are symmetrical in position. I couldn't appreciate any redness, any swelling, any bony deformity or muscular wasting on the anterior aspect of the shoulder. Now I'll be going behind you. Is that okay? Yes. I couldn't appreciate any swelling, any redness, any bony deformity or muscle wasting on the posterior aspect of the right shoulder. I'll be verbalizing my findings to the examiner, so kindly bear with me, Mr. James. Okay. Now I'll be touching you for the purpose of examination, so kindly bear with me. Okay? I couldn't appreciate any localized rise in temperature. Now I'll be touching you a bit deep. If you feel any discomfort at any point, just let me know. Okay? Oh, I'm really sorry about that. Are you alright? Yes. Shall I continue? Yes. Do you need any painkillers? No, fine.
Du har forgåelse. Man in black.
Do you feel any pain? My patient is having pain on the anterior aspect of the right shoulder. Now I'll be asking you to perform some movements. Is that okay?
Yes.
Could you please raise your arms like this from the front? Thank you. Flexion is normal on both the sides of my patient. Could you please extend your arm backwards like this? Thank you. Extension is normal in my patient. Could you please tuck your elbows in your tummy and then move your forearm outwards like this? Thank you. External rotation is normal in my patient. Could you please make a thumbs up sign and then scratch your back as much as you can like this? Internal rotation is limited in my patient. Could you please cross your hands like this? Adduction is normal in my patient. Could you please raise your arm from the side like this? Both the arms. Okay. Is it painful?
Yes.
Can you try lifting your arms? Can I assist you?
Yes.
Okay. You can leave that. Is it painful? Is it painful still? Painful arc test is positive in my patient and abduction is also limited in my patient. Now I'll be performing some special test in you. Is it okay?
Yes, sir.
Tell me if there is any discomfort at any point. I'll stop my examination.
Right.
Okay. Could you please move your hands a bit forward? Thank you. Could you please make a thumbs up sign for me? And then now make a thumbs down sign as if emptying a can. Thank you. Impingement test is negative in my patient. Could you please bend your elbow? Thank you. Try resisting my movement. Okay. Apprehension test is negative in my patient. Could you please raise your arms? Thank you. Now I'll be leaving it suddenly. Just try holding your arms in the same position. Okay. Drop arm test is positive in my patient. My patient probably has a rotator cuff tear. Painful arc test is also positive in my patient. My patient probably also has supraspinatus tendinitis. Could you please bend your arms a bit? Thank you. Could you please resist my movement? Thank you. Pete's test is negative in my patient. Now I'll be feeling for your pulse. Is that okay? I could appreciate the radial artery. Could you please wiggle your fingers? Thank you. Thank you, Mr. James. You've been very cooperative. You can now address us. I'll thank my examiner. If the examiner asks of the diagnosis, verbalize the thing. You can also tell again. You can also tell the diagnosis again. But